All right, guys, this is a training video on lumbar and cervical decompression. This is the beautiful Gwen, my friend.
All right, so Bob, you're gonna lay down, belly button right about here, and face right up in there.
So you see the way the harness is set up, guys? Open like that.
Yep. All right, and we're gonna make this
Got the face cradle.
belt as tight as possible. It's gonna go right around their hip area. If like men have belts on, it's easiest like right above the belt line. And we're gonna hold this with our right hand, and then we're gonna hold this strap, and you put your finger right in here with your left hand, and you're gonna go as tight as possible. Don't be afraid to make it nice and tight. And then the skinny strap is gonna go around, same kind of thing. Make sure this circle is right in the middle of their spine, and you are going to take this and make this as tight as possible as well. Alrighty. Now, this should be right in between their legs. This white line should be right in between the legs. We're gonna hold these two circles, and we're gonna fold this strap in half, and this hook is going to hook onto this circle. All right, so now we have this like this, and we're gonna connect it to the actual machine. So it's like that, and then we're going to rise it all the way up. And we're gonna use right here, it says lock and unlock. We're gonna unlock the table, so that now the table is able to move. All right, and last, we're just gonna lift your feet up, Barb. This is just for comfort. And there's that. So to figure out how much we're gonna pull, Barb, what's your body weight?
150.
All right, so you're gonna take any calculator, and you're
It's
gonna
located
do
over there.
150. So anybody's body weight, and you're gonna times it by 0.3. So that's always 30% of the person's body weight. So you're gonna do 45 pounds. So this is a little trickier to explain, but you're gonna set the hold. This is all written down as well, so that the more detailed. So the hold is going to be her number, which it's every other number. So it's gonna be 44, and then the rest is gonna be half of that. So we're gonna do about like 20 would be good.
Okay.
So the first time it's 8 minutes.
So it's gonna pull, if I understand, pull,
Yeah.
pull at 4 pounds
Mm-hmm.
and rest for 20 seconds.
Or no,
Rest-
so it's
rest-
gonna pull for 44 pounds, hold for about 45 seconds,
Okay.
and then it's gonna drop down to 20 pounds, and
Got
it's
it.
gonna hold that for 25
Got
seconds. The total time is 12 minutes. For anybody's first pull, we do 8 minutes. So you just click that and rotate that down,
Okay.
and then set it, make it sure it's set. All right, and then you just press start, and you can see right here in the actual, it's going to slowly increase the number. When that gets to 44, that's when you know it's at the full pull,
Okay.
and then it's going to drop down.
Perfect.
So that's it.
All right. So let's just roll right into cervical.
All right, perfect. So to unstrap anybody, you're going to wait till this goes all the way down. This actual number has to go to 0, because if you start to pull at it, it won't let you. It will be tension.
Okay.
So you're gonna do it the opposite of how you strapped her in. So you're gonna unhook that first, and then unhook this, bring this down, and then you're gonna unhook the belt and the Velcro. Make sure everything's nice and neat. You can take this underneath their feet, and you're
And
gonna
is it important to lock the table?
Yes. So we're gonna bring them all the way down, and we're gonna lock the table so now that doesn't move.
Got it.
All right, bring them all the way down. All right, Barb, you're all set. You can come on off.
How do you feel, Barb?
Wonderful. So good.
It is a comfy table. All right, so now to transfer into cervical, you're gonna.
And is there anything different when you're doing a face-up pull, Gwen? Same procedure.
Same procedure, but you have to use different things that we have here. So we have to have like these pegs, or we have those wedges to keep them in place.
Got
So you
it.
just put the wedges around their back rib area, or these go underneath the, kind of hard to show, but underneath the arm, and they stick to the table like this.
Oh, perfect.
So, yeah.
Got it. Okay, perfect.
And then also the pad, this pad would go underneath their
Their
knees
knees.
instead of their feet.
Perfect.
Or you can raise the table up, and they can relax on the table.
Nice.
Whatever, it depends on what they're comfortable with, because you don't want to be in any pain when you're on decompression.
Okay.
So we're gonna clear all this stuff off. Thank you, Barb. All right, so for cervical, you have two pieces. They're always right up here. This is for just more comfort, and this is what their head's gonna rest on. So you're gonna put these right about here.
So they're laying the opposite way, obviously.
Yes, so they're gonna be attached this way, and they're gonna pull this way instead of the other way.
Okay.
We do have, he's actually, you know what? Sorry, I'm gonna show you on the other one, because he's ordering the newer version, so we
Okay.
won't even have that one anymore. So I can just bring this over here. So this is the newer version. This newer version has a hook on the back of it, which helps keep it in place.
Okay.
So you're gonna hook this to the table. There's a little bar, if you wanna look at that. There's a little bar right here.
Okay.
And you're gonna hook it to the table and pull it as taut as you can. Thank you. All right, that should always be in there. I just thought. Then we have this little cushion. This just helps with people who are really skinny. You put it right inside here,
Okay.
and it just helps with like
Locks
comfort.
under the skull.
Yeah, or you can, if they're a larger person, you can just do it like this, and you don't need any
Got it.
padding.
And obviously that wants to be pretty tight.
Yes.
Yeah.
So this pad is just gonna go underneath here for their shoulder area. And then the last thing you do, so once this is all set, the last thing you do is you just bring this up about like, I would say 1 inch
Okay.
on both of them. That just helps with the pull
For
as
both
well.
pieces.
Yes, both pieces. All right, Barb, you can lay down, neck right in here, and they're gonna be face up. Perfect. So there's 2 things to do to strap them in. One, we're gonna push this in nice and tight around their neck. And then we're gonna get the headband, and the headband is gonna go across their forehead.
So a little paper towel.
Little paper towel just for cleanliness. All right. So we're just gonna strap this in, and then we're gonna tighten this. We don't want this too tight because it can cause headaches when they're on here, but just, you know, just secure. I like the word secure, just to ask the patient, do you feel secure? Barb, do you
Yes, I feel secure.
Cool. All right, so we're gonna hook that onto this hook right here.
Okay.
And then the same thing, we're gonna rise them up. For cervical, we want the table to be locked because we don't want the table to move.
Got it.
This is what's gonna be moving.
Perfect.
And we're not gonna rise it all the way. We wanna rise it 75%, I would say.
Okay.
We don't want anything to be touching this rope because that's gonna cause tension.
Okay.
So if you rise it all the way up, it's either gonna hit here or it's gonna hit here. So we want it nice and clear of anything. And then to switch it to, from lumbar to cervical, you're gonna press and hold down on the stop, and it's gonna start beeping. So you're gonna transfer to this. This was
SC3?
SE3.
Okay.
I have to fix this though, so kind of just ignore these numbers.
Okay.
We have to reset it. It was messed up. So it's gonna be 30 is gonna be the hold, and then 15 is gonna be the rest.
Okay.
And the maximum hold is always going to be 20. So for everybody, the maximum hold is going to be,
20 pounds.
yes, 20 pounds, and then the rest is always 10. That's always the same for everybody. The first time they go, it's going to be 8 minutes,
Okay.
but anytime after that, it's always going to be 10 minutes.
Okay.
So once this is all set, this is how it should come up, and I'll fix it so it comes up like this, and you're just going to press start. So the same thing, this actual is going to increase until it gets to 20. Once it gets to 20, it's going to hold for 30 seconds. That will count down, and then it will go back down to 10 pounds, and then this is going to count down, and it's just going to go back and forth.
So this isn't for cervical a percentage of their body weight. It's
No,
always
it's
20.
always 20%, or always 20 pounds.
Even if they have a huge head
Even if they have a huge head.
or a huge neck.
Yeah. Sometimes Dr. Tom will increase it, but that's after they've been doing it for like a long
Right.
time.
Got it.
So to undo this, you have to always wait till the actual number gets down to 0,
Okay.
or it won't let you. And you're gonna unhook this, and then unhook this, get the paper towel, and then you just lower them all the way down. And that is it.
Awesome.
There you go.
That's perfect.
Yeah.
All right. Well, thank you, Gwenny.
You're welcome.
And Barbara, thank you.
I feel